A pathologist examined histological section and identified a Hassall's corpuscle with what they most commonly associated. That means Hassall corpuscle, they are found in which of the places. So the Hassall's corpuscle, we have to keep in mind Hassall's corpuscle, where it's usually found. Here the options are follicular carcinoma of the thyroid, medulla of the thymus, medulla of the spleen, medulla of the kidney, and fundus of the stomach. So where there is the Hassall's corpuscle located. First of all, let's see this different structure of the thyroid gland, of the thymus. The thymus, it is developed from the third and fourth pharyngeal pouch. This is very, very important, that the thymus, which is one of the gland, and it is derived from the third and fourth pharyngeal pouches, which lies in the superior mediastinum of the thorax, and it is encapsulated and it is divided into two parts, which is the cortex and medulla. So like other organ such as the spleen, such as the other organ, the thymus also, it has the cortex and also the medulla, and it is composed of tightly packed lymphocytes. So the thymus, actually in the thymus there is huge number of the lymphocyte present, because the thymus acts as a training center for the lymphocyte. And so in the thymus, the lymphocyte gets definitive type of the training, then they circulate in the blood, and they are responsible for different type of the defense activity. On the other hand, the medulla of the thymus, it consists of largely epithelioid cell, which is the thymocyte. That means the thymocyte, they are present in the medulla, and the medullary epithelial cell or thymocyte, they are concentrically arranged and may surround a keratinized center, which is known as the Hassall's corpuscle. So Hassall's corpuscle is a definitive term for the thymic medulla. That means medulla of the thymus, there is definite structure present, which is the Hassall's corpuscle. And what is this? This is the aggregation of the medullary epithelial cell with a central keratinized area. And some other important parameters here, such as the inferior parathyroid gland, also developed from the third pharyngeal pouch and may located may present with the thymus gland. And the arterial supply, the thymus, as it is located in the thorax, so it receives blood supply from the internal mammary artery and also the pericardiacophrenic arteries, and blood venous drainage into the left brachiocephalic vein. And this Hassall's corpuscle, that means the aggregation of the epithelial cell within the medulla of the thymus, it usually is stained by the hematocrit xylem and eosin. So here showing the Hassall's corpuscle. This is the Hassall's corpuscle. What is it? It is a cluster of the thymic epithelial cell, and it is unique to thymus. That means it is not present anywhere in the body, only present in case of the thymus. And it is the concentric lamellar pattern. Here we can see this area, this is the concentric lamellar pattern. And these Hassall corpuscles are concentric ring of the epithelial cell seen in the medulla of the thymus. Here we can see this is the concentric pattern of the thymocyte present here, and it is known as the Hassall's corpuscle. So Hassall's corpuscle, it present medulla of the thymus. It is definitive for the medulla of the thymus, nothing else.